Right, our first speaker this morning is Claire Hurst. Claire has got 25 years experience in sexual health. She's been project manager of the STI Education Foundation. She's established the Herpes Foundation in New Zealand and the New Zealand HPV project. And in regards to in the STIEF in 2001, now I googled STIEF the other day just to see, get a bit more information on that, and found out there's a guy called Bo Steve. He's a world-renowned jazzist from Denmark. He's coming to New Zealand next year. I'm not sure if Claire's going to sing a song also, but for her title, STI Hub New Zealand, please welcome Claire.
Thank you very much. Now, how do I operate this? Do you know? Sorry, I should have learnt this before I came up. Anyway, thank you very much, and thank you for coming, and most especially thank the Society for providing me with this opportunity to tell you where we're at with a very early stage of developing an STI hub, and include all of you in this room in the journey and the consultation and the collaboration. Thank you. So I just want to give you a very brief background. John's introduced me, and probably many of you will know me. I keep bouncing back. I'll leave eventually. In the mid-1990s, a consumer group of people with herpes actually drove the establishment of the Herpes Foundation, and that base of it being a consumer-driven group, allied and partnering with medical and health professionals, I think gave it the strength that it has had to date, and still involves patients, and we have a support group that some people that want to speak to somebody else with herpes can access. So for the last 20 years, Herpes Foundation has been there. The sister project of the New Zealand HPV project was established in the same model because of the professional advisory board saying, look, let's do this with HPV as well, it's needed. And long term, with a contract that we've had from 2001, first of all in 2001 with the ministry, and they devolved it to DHB, so it's a national contract with equal contributions, or per head of population contribution, small one, from all district health boards. So it's actually managed, the contract is actually with DHBs, not with the ministry, but we report to the ministry, so figure me that. In 2013, our contract was expanded to include all STIs for long-term survival, because we didn't think it was realistic with a small but reasonable amount of money to be concentrating just on herpes and HPV, which are established models, when the model could easily be expanded to include all STIs. So we've just had our contract renewed for another 2 years till 2016. So we're at the beginning of this journey. The foundation has 4 directors that provide governance. 2 of them are sexual health physicians, Edward Coghlan and Anne Robertson, 1 GP from Christchurch, Dr. Phil Jacob, and a patient from Auckland. The patient from Auckland is in marketing and advertising and provides wonderful help and advice around anything to do with marketing and our information. So we, in this instance, from now on in, are partnering with the New Zealand Sexual Health Society. We've been around for many, many years. Our HPV and herpes model are measured every year, every month, in fact, through website and helpline calls, have been a successful model that are very well established in primary health care in New Zealand. And we build from the ground up. We work collaboratively, and now we have our funding till 2016. So our it's always helpful, I think, and we learnt this throughout all the presentations yesterday, and yesterday, the last one in the afternoon reiterated this, that you establish a common objective at the end. And I think that everybody that's attended this conference, wherever you come from, whatever area of sexual health you work in, all of us will have the common objective of wanting to get optimal management for people with STIs. So with that goal in mind, that has been our primary objective for the Herpes Foundation and for the HPV project, and now for the STI Hub. And what is optimal management? You could argue it, but from a clinical perspective, and we're bringing it back, we're not going to go out in a big wide sweep and try and do everything, but from a clinical perspective, it is ensuring that people with an STI get a timely and accurate diagnosis, they get appropriate medical management and safe medical management, and they get education and support. And we aim to assist with that by optimising consumer, professional and public awareness through support and education. How have we done this to date? The toolkit that we've used, the model that we've used, is we have consumer and clinical resources. We have provided over the years CME. That whole scene is changing with the different way that CME is delivered, and there will be different ways of looking at doing this with the Sexual Health Society and their website. We've got the wonderful New Zealand Sexual Health Society guidelines, so we don't have to reinvent the wheel. We have a helpline. We have the 2 websites to date, and when the opportunity and the funding is there, we do public education through media and TV. So how do people access information? And this was published in the Herald last year in a timely, just as I was in the middle of this journey of collaboration and consultation and hearing from people. And I want to acknowledge, sorry, I should have opened this presentation by acknowledging the Sexual Health Society, Terry and Clark, Robert Muller, Alex Massey, Alison Green and Te Pua Waitapu, who are coming on this journey with us. So everywhere pointed to the fact that the World Wide Web is the place that people go, but you could say, well, yes, we all know they go there, but show us the research. And there, this popped up. This research results was published in the Herald, and it showed that 67% of young people, their first port of call for information is the website. So that has supported our decision of, in the first instance, the first project with this expanded STI agenda is to create a consumer-focused website on STIs. Credible, modelled on the herpes and HPV sort of overall delivery model, and consumer focused, and will provide information on STIs for both public and healthcare providers, and will provide easy to access, up-to-date information and with downloadable resources. And one of the questions that I still am getting different answers about, and I'd like to put to the floor, is do you believe that we are ready for just having information online, or some of the handouts hard copy? I know that there is a lot of information out there, but I just need to flag that question for you to think about. So we are still in phase 1, doing research and investigation and collaboration. We have looked at all the resources out there, and there are a lot of wonderful resources, but they're not disparate, but not everybody knows where to get them from. Different resources are available for different people. We have brought on board, we have collaborated with a wide network in the sexual health sector, from health promotion to youth, one-stop shop, both staff and youth. We've researched the current market as to what's out there regarding a STI website, and we're trying to engage all sectors in this journey in order to both get a website that delivers to the audience that we want it to be delivered to and has got buy-in and support from everyone. And it will also maximise the dissemination and uptake. So there are a lot of websites out there, and I'll get to that in a minute. What we know and what we've heard through the years, and again today from Terry Ann Clark, is that the highest group is the hardest to reach group of Māori and Pacific youth. Their STI rate is high. They are traditionally the harder to reach group, so it's absolutely essential in this early stage and in the first look of this website that we reach this target group. And to that end, I'm internally grateful to the partnership with Te Pua Waitapu and Sexual Health Society that have come on board to help us achieve this. And the sexual health youth groups throughout New Zealand that are doing such wonderful work. I live in Northland in a very remote area, and I've been meeting with youth group in Whangarei and Bronwyn, the health promotion person that presented a lovely paper yesterday about her work in Kaikoi. So the feedback to date has indicated that everybody believes there is a space for a website devoted solely to STIs that's practical, consumer-focused, easy to navigate. That there are a lot of websites out there, and a lot of them provide information on STIs. Family Planning got a wonderful one, Sexual Health Society, but there's none that are just dedicated solely to STIs and where to go for help. It needs to be high quality and evidence-based, simple and user-friendly. Potentially, and this is going to be the challenge, that whether we can make the information generic that will go across the boards, and how we reach the harder to reach groups and engage them and provide them with information. Broad clinical approach, and we will it's very easy these days to have multiple languages, so that's not a huge expense to translate it into different languages. So we have established, I believe, there is an opportunity for this West STI hub. Most importantly, it needs to reach, engage and inform young Māori and Pacific, and we're very grateful that Te Pua Waitapu are on board with us with this journey and have undertaken focus group research to help us understand and know how we can do that by themselves talking to young Māori, and we're going to take them on I've just been speaking to Jordan, who you'll hear from next, and we hope to involve that group with us as the website is developed. So reach, it needs to be content management system, allowing easy updating, responsive to all devices, search engine optimised, and best practice social media being used on it. It needs to engage by being creative and user-friendly, and it needs to provide simple answers quickly without too much searching around to provide people the information they need. These are absolutely, you have to start somewhere. These are not the final creators that we're trying to decide out of, but we've come up with a couple of potential looks, and the journey is still to decide whether for one particular target group we need to have a different landing page that looks completely different to this, and have a different one for sort of a generic website, whether we can get one that everybody would go to and engage with. We've yet to find out. It's a journey. The homepage topics that have been identified as I've been doing my discussions and journey and talking, and this sort of tends to increase this, but keeping it simple, how they get there needs to be studied and researched as to what words young people will be thinking in their heads and key into a Google engine. and they have to be incorporated into the website. But when they get there, they're going to want to know, well, you know, what is an STI? They might even not know what an STI is, because some people call them STDs or other words. So this still needs to be a journey that we explore and work out. But what is an STI? Do I need a STI check? How do I tell a partner? Are you pregnant is something that, as I've been working with health, youth, and talking with family planning, that you can't, what I've learnt yesterday over all the presentations is that you can't silo things. You can't have a person that's pregnant and not think about if they've got an STI, or a young teenager that's got pregnant may have an STI. So when you need to use all of the parameters that they might, worries in their head that they might have, to get them onto the website and then provide them with the information and the route to go, where to go. What does safer sex mean? Where do I go for help? So what then? If the pond is dry, we're not going to be much help. And this is the epiphany that I've had in the last 9 months. Coming from rural Northland, I have realised that the biggest challenge for us all, and we've been challenged all day yesterday to think about how we can do this better, is that an individual, a 17-year-old with no money and no ability to get from Kaikoui into Whangarei to a clinic or make an appointment, might need to be seen then and there in Kaikoui. When, how? They need timely, trusted access, both urban and rural, no cost barriers, and providing both sexual health and contraceptive management in the one visit, not separately, because that's too much of an ask for some of these kids. Are these services available throughout New Zealand? They differ from region to region. It is a dog's breakfast, and somebody said, and I think it might have been Jane, I wish you luck in trying to establish where and what services, because throughout New Zealand the fact is there are wonderful services, but they're not throughout the entire New Zealand, and they're not able to be accessed by every individual in rural areas that needs them. So family planning, GPs, youth groups, youth one-stop shops, it's an endless list, but I think that we have to start thinking outside the square here and start from the consumer rather than the provider, and think, okay, we've got a consumer in Kaikoui. It's a girl of 17, and she's pregnant, she's worried, she has been having sex with a number of people and could have an STI. Where does she go? There isn't anywhere for her to go.
Excuse me?
Yeah, sorry. Yeah. Sure.
There's a lot of things going on. But you know, communication, right?
Yes.
I had no idea that this was all going on. I think it was GP program. What's the problem here?
Yes. Absolutely, and that's the opportunity that we've got here, and that's terrific to hear from you. So, no, absolutely, I understand. Thank you. I think, yeah, okay, so there's a number of small rural towns in New Zealand where the choices for that kid getting help might be challenging. So, opportunistic sexual and reproductive health management. Can we think outside the square? What health professionals come into that girl's life, and which of those would she trust? School nurses, smear takers, Pacific and Maori health workers, midwives. This is throughout New Zealand, it's not just in Kaikoura. I'm just thinking about throughout New Zealand, what are the health providers that reach these hard to reach groups in rural New Zealand? Could we upskill them and through digital support by expert centres or an expert person on the phone? Provide them with the ability to give that person the total holistic care that they need when they see them. I don't know, but it's food for thought. So in summary, we would like to deliver an STI hub based on the herpes and HPV models. We want it to provide information. The keys are to reach, engage and inform. We believe in the first instance that online is the best way to deliver this information in today's target groups. Māori and Pacific are a particular focus, and collaborating with related groups and communities will provide the best outcome. So I invite you on board for feedback. This is not, that's just a graphic, it's not the homepage, but we will be developing some homepage creatives. The topics on the homepage, if people want to email me their thoughts. And is there still a place for hard copy, say chlamydia, a one-page chlamydia? I don't know. I mean, I know that the herpes hard copy resources for patients are used by the thousands, and I don't think if we had them only online that as many people would get them and be helped with that information as if they weren't available hard copy. And actually hard copy resources aren't that expensive once they have been developed to print and distribute. So thank you for listening, and I welcome your feedback.